Hello, this is Josh Lamb from the Leeds Institute of Rheumatology and Musculoskeletal Medicine at the University of Leeds. I'm speaking to you about my JBJS article called Risk Factors for Revision of Polished Taper Slip Cemented Stems for Periprosthetic Femoral Fracture After Primary Total Hip Replacement. In general, periprosthetic femoral fractures have a bad outcome despite the best treatments, with approximately 10 to 15% risk of major complication and reoperation. Given this, the best way to reduce harm to patients is to prevent fractures in the first place. We might do this by changing the implants we use, changing the way we use them, or changing the design of future implants to reduce the risk of harm to patients. Much like epidemiologists look at specific risk associated with the features of people, like age, race, and genetic code, we estimated the risk of fracture associated with design features of implants used in total hip replacement using registry data from the National Joint Registry here in the UK. We found that the risk of fracture increased with age, interruptive fracture, increasing stem offset, and head size. Interestingly, the risk of fracture also increased with stems where the diaphyseal portion was round or ovalloid in cross-sectional shape, and stems which were made from cobalt chrome versus stainless steel. Importantly, the time to fracture was also significantly less for cobalt chrome stems. And when comparing stems which were made of both cobalt chrome and stainless steel and were otherwise identical, we found that cobalt chrome stems had a 5-fold increased risk of fracture in comparison to stainless steel stems. But also, when lower viscosity cements were used, the risk of fracture associated with cobalt chrome stem material increased to over 20 times that of stainless steel stems with high viscosity cement. So what does this mean? Well, simply, when increasing the head size and offset during hip replacement, the risk of fracture should be weighed up against the risk of instability, particularly in older patients. Going forward, the risk of fracture associated with cobalt chrome stems is likely to be a real phenomenon. Given that cobalt chrome stems fractured earlier and more frequently when used with lower viscosity cements, it's likely to be a wear-related phenomenon at the stem-cement interface, and we're hoping to test this experimentally in the next year. Thank you.